treated primarily by giving advice about the fluid and salt intake. There will be restriction of salt and water intake. There, we advise the patients not to take any added salt. That means the patient will take the normal salt that is given in other situations with other dietary components. So no added salt in the plate will be taken. And fluid restriction, it means that the patient should restrict the oral intake of water and other fluids to 500 ml plus previous day urinary output. The drugs that is used in heart failure are ACE inhibitors or angiotensin receptor blockers and loop diuretics. These two drugs are used most commonly. And when the heart failure is a bit improved, then we add beta blockers. Another important aspect of the treatment of heart failure is detection and treatment of complications. Because heart failure can lead to respiratory failure, cardiogenic shock, arrhythmias, acute kidney injury, electrolyte imbalance. And any of these 5 complications would prove fatal. So apart from treating the heart failure patients, we must also look for the complications. Only treating the diseased heart does not save the patient. Other fatal complications must be looked for and should be managed accordingly. And finally, the identification of the cause of the heart failure and treatment of the cause if possible. Suppose this is a case of heart failure due to hypertension, then hypertension should be treated. If this is a case of heart failure due to acute myocardial infarction, then the patient should be treated in the coronary care unit for acute myocardial infarction, just like this. If this is the case of heart failure due to valvular heart disease, then proper treatment, valve replacement or valve repair should be done. So this is drugs which are used when heart failure is not controlled, is not improved with the use of the first-line drugs. These are aldosterone antagonists, digoxin, and nitrates. Finally, there are 2 special treatments that can be used in very advanced refractory cases. One is cardiac resynchronization therapy, another one is cardiac transplantations, but they are not readily available. Acute heart failure has its own importance in heart failure because acute heart failure is a medical emergency. So you have to know about something more regarding acute heart failure. It usually presents with sudden severe dyspnea, and apart from dyspnea, the patient may have cough and rarely the patient may have hemoptysis. The only finding that will make you think about acute heart failure in such a dyspneic patient is bilateral basal collapse. So what are the causes of acute heart failure? The most common cause of acute heart failure is acute myocardial infarction. Acute heart failure means the heart failure is developing within hours. It is so severe, the dyspnea is so severe that it brings the patient to the hospital within hours. So the cause of such severe heart failure developing within hours must be something dramatic. That is why acute heart failure is caused by some dramatic conditions like acute myocardial infarction, then hypertensive emergency. I have already said hypertension can cause left ventricular failure, but to produce acute heart failure, the hypertension must be very high, hypertensive emergency. It means systolic blood pressure more than or equal to 180 or diastolic blood pressure more than or equal to 110. This is called hypertensive crisis. And when it is associated with any target organ damage, it is called hypertensive emergency. Finally, any patient with chronic heart failure, if the patient stops the drugs abruptly, it may lead to acute heart failure. And development of any arrhythmia in a chronic heart failure patient who was otherwise reasonably well, or suddenly a ventricular tachycardia develops, then the patient from chronic heart failure will turn into a case of acute heart failure. So these are the conditions which makes the heart failure very severe within minutes and brings the patient to be admitted in the coronary care unit. The first thing to be done is putting the patient in propped up position and starting high flow oxygen. In acute heart failure, it is invariably the patient has respiratory failure. So the high flow oxygen is essential in the management of acute heart failure. Then the patient should be given intravenous furosemide, and the patient should also be given intravenous dopamine if there is cardiogenic shock. So not all acute heart failure patients will have cardiogenic shock. So if the patient has cardiogenic shock, in addition to these 3, propped up position, high flow oxygen, and intravenous furosemide, you have to add intravenous dopamine to maintain the blood pressure. And one thing you must not forget, that is, you should do an ECG and troponin I to exclude acute myocardial infarction. That there is no myocardial infarction in acute heart failure. We have to detect any myocardial infarction in acute heart failure. And because acute myocardial infarction needs extra, they didn't want to, the diagnosis is obviously it is left ventricular failure, that means dyspnea with bilateral basal collapse. Diagnosis is left ventricular failure. So the clinical information means the points in history and clinical examination, and that will help you finding the cause. So if you write the cardinal signs of left heart failure, like bilateral basal clefts, pulsus alternans, gallop rhythm, these are useless in this answer because they have already said this is left heart failure, but they don't want you to establish left heart failure. They just want you to find out the cause from history and clinical examination. So for this answer, you first have to consider what could be the cause of this condition. The most important cause of these conditions are myocardial infarction, hypertension, mitral aortic valvular disease, and myocarditis. So you first have to write these are the more important causes of this condition, and then you make a